Hello, this is Dr. Do again. This video is on alphabetic list problems on letter P. I have talked about some of the diseases that started like the pneumonia or the postmenopausal management. And the next on the list to my mind is the pulmonary embolism, which is quite serious and not uncommon. However, I did have mentioned and talked about this pulmonary embolism in the lung section, so I'm not going to talk about that. And there's another like pneumonia. I have talked in different streams. And the other common conditions come to my mind is the Parkinson's disease. You probably heard it a lot, either your neighbors or your co-workers or your families, or grandparents. It's quite common. In addition to the genetic predisposing risk factors, it's really a degenerative change of the nervous system located in the basal ganglia in the brain and also the substantia nigra. So that's the structure, foundation of this Parkinson's disease. And let me just bring up the emergency situation, whether there's any emergency situation associated with this Parkinson's disease. Parkinson's disease itself is a slow, chronic, progressive disease. So isolated Parkinson's disease is not an emergency, but need to be diagnosed by your physician as soon as you find something abnormal in terms of your muscle strength, muscle rigidity. So if that's the case, see your physician, particularly for older people, particularly for those who have family history of Parkinson's disease. However, because of the Parkinson's disease, impaired muscle function, increased muscle rigidity, easy to be trembled or to fall. So if that's the case, definitely, regardless, actually, for older people, falling is quite common and is an emergency, regardless of the cause. So you need to see the emergency room as soon as possible. The other associated emergency situation is the medication side effect, or kinesia. So that's the case. You need to see the emergency room. Other than that, like I said, isolated Parkinson's disease is a chronic process. Can you manage at home? Probably not. You probably know it. Has to be diagnosed by the physicians, either your primary or the subspecialist, like a neurologist. Has to be managed by the prescribed medications to manage. So then, so what kind of presentation of this Parkinson's disease? Particularly, it's quite common, and also the onset age for this Parkinson's disease is kind of getting younger. A lot of degenerative diseases start in terms of the onset age, starting getting earlier and younger. So the symptoms for this Parkinson's disease, typically you probably know the tremor, which is called resting tremor. When the patient have this kind of disease, rest the hands on the leg and then just have this rolling ball like tremor, shaking, and also increased muscle rigidity, cogwheel rigidity, like or the lead pipe. That's what it's called. So if you move the arm, not like normal muscle strength can hold, gradually bend your arm, but for those people with Parkinson's disease, it's really the sharp angle movement. That's the sign of increased muscle rigidity. It's like a really straight and a lack of the flexibility. And also, in addition to that, the walking also, because increased muscle rigidity, the walking steps are small but fast, have to be fast. If you recall, the child, when they start to learn to walk, actually they run first, because the balance, they have to catch the speed in order to maintain the balance. We always say learning walk before you're running. Actually, as a matter of fact, the kids, when they start to walk, a lot of time they start to run first and then to be steady, because the speed can help maintain the balance. So that's the same idea for this older people with this Parkinson's disease. Because of this small steps and increased muscle rigidity has to be fast, so it's called a hesitated gait. So that's a special term for this kind of shuffling gait with hesitation, that is called. So this is about the clinical presentation, and sometimes this Parkinson's disease could accompanied by the dementia. There is a Parkinson's disease cause dementia, usually about 1 year or so to develop symptoms. So this is about the, in terms of diagnosis, it's quite straightforward. Just the clinical symptoms, and also sometimes image study may show the abnormalities of the structure, like a basal ganglia and also the substantia nigra. So that's the imaging study. And in terms of management, the mechanism is because of the structures, depletion of the dopamine or degenerative change of dopaminergic nerves. So that's the explanation. So the treatment, of course, to replace the dopamine, the precursor of dopamine, levodopa. So that's the medication. There's a variety of brand names that comes with this same component, and decided by a physician what kind of medication is suited for you. So this is about the Parkinson's disease. In terms of the prognosis, it's really the it's irreversible change of the brain. So the medication or treatment, the purpose for medical management is to slow down the progress, and also to treat the symptoms, like decrease the muscle rigidity and decrease the tremor, and also improve the function level. In terms of the heal or reversible, it's not that kind of prognosis. So, and the slow down of progress is also very important, because otherwise it's going to get worse and worse, loss of function, cannot walk, cannot living a quality life. So this is about the Parkinson's disease. I hope it helps, and the take-home message is, if you know you have the risk factor, for example, the family history, or if you notice your muscle strength is changing during the for the older people, you cannot do what you have been doing, or if you notice your walking pattern, or your movement of your arm, of your leg is different from previously, then you need to talk to your physician to examine, and also to, if necessary, to do the image study to check the brain structure. So that is about the, this video, Parkinson's disease, and I hope it helps. And thank you for watching. I will see you next time.